Question: a year-old man with a history of hypertension, hyperlipidemia, and mild hearing loss is brought to the hospital by ambulance after a motor vehicle accident. He is intubated in the ED for airway protection and undergoes massive blood transfusion for hemorrhagic shock. He is admitted to the ICU. Which of the following reduces the risk of delirium in the ICU? Option A. Benzodiazepine-induced coma. Option B. Mechanical ventilation. Option C. Polytrauma. Option D. Metabolic acidosis. Option E. Sedation with dexmedetomidine. The correct answer is option E. Question: a year-old man is admitted to your ICU after facial assault with a penetrating object through his orbit. You are called to the bed city and post-op day after removal of the object because the patient is in severe pain. Upon your examination, the eye is swollen, injected, movements are difficult to assess because of pain. He has light perception on visual acuity, which is unchanged from the time of presentation. What is the most likely diagnosis? Option A. Orbital cellulitis. Option B. Orbital hematoma. Option C. Cavernous sinus thrombosis. Option D. Carotid cavernous fistula, CCF. Option E. Orbital compartment syndrome. G. And pulsate in the pupil is minimally reactive and extraocular. The correct answer is option D. Question: a year-old man is admitted to the neurointensive care unit for aneurysmal subarachnoid hemorrhage, SAH. He is intubated on mechanical ventilation. On day of admission, he develops septic shock. He is fluid resuscitated and broad-spectrum antibiotics with early and aggressive treatment. Hours later, he remained hemodynamically unstable, necessitating escalating doses of norepinephrine, mg per hour, to maintain a systolic blood decrease, vasopressor requirement, and mortality in septic shock. Option A. Switch antibiotics to linezolid plus meropenem. Option B. Add vasopressin infusion. Option C. Add intravenous, 4, infusion of hydrocortisone 200 mg per day. Option D. Add oral fludrocortisone 50 micrograms daily. Option E. Add 4 hydrocortisone 50 mg 4 times a day plus fludrocortisone. G. Pressure, SPP, 90, which intervention has been shown to? The correct answer is option E.